Jason Jones, and welcome to our video on the 3 most common myths about chiropractic. The very first one is really, I almost can't say it without laughing because I think it's really ridiculous, but I think people do still say this, which is chiropractors aren't real doctors. So my question is this: what is a real doctor? I mean, do you have to have a stethoscope, a white coat? Do you have to prescribe medication, and do you have to have MD at the end of your name? The honest fact about it is that chiropractors are real doctors. We're recognized in 50 states, as a physician, but there is a difference between, say, medical doctors, osteopaths, and chiropractors. The schooling is very similar. Almost the exact same number of hours of schooling, but things are different because we treat differently and we do things differently than what they do. So, but if you look at it in this way, a cardiologist is a doctor, but so is a urologist. But they do totally different things, just as an orthopedist does things totally different as well. And they're all real doctors, just like we are. We just choose to do things differently. The second most common myth is that chiropractic, I almost can't say this without laughing either, is that chiropractors will make you go forever. Once you go, they make you go forever. It really is laughable because I'm a busy guy. I've got 2 small kids, a family. I have my office to operate, and I really don't have the time for a tremendous amount of stress. And the first thing that comes to my mind when people say that is I think about the policeman shows on TV where this lady is 100 pounds and it takes 5 guys who are over 200 pounds and big and strong just to get her in the car. So you can't make anybody do anything. People are going to do what they want to do no matter what you say. But let's talk about the truth and what the real facts are. Is that for the most part people do come to our office because they have some sort of ailment or something. Most people don't have what we call the wellness mindset. So they have their ailment, and then all on their own they choose to continue treatment and come periodically to either avoid having that problem happen again, or for those people that get the big idea of chiropractic, which is chiropractic plays an integral role in your health and well-being by taking pressure and irritation off of the nervous system. And the fact that the nervous system controls everything, and we take the pressure off of that so that it functions as close to 100% as possible, they choose to have that as part of their health routine, just like exercising or eating right or whatever. Because honestly, the human body is a lot like a used car. It needs work, it needs maintenance, it needs tune-ups, it needs oil changes, it needs to rotate the tires. And if we don't do it, we know the car is not going to last as long. But in all actuality, again, people are going to do what they want to do, and I can't make anybody do anything. It's just too stressful. So that's just sort of how it is. Now the third myth is really this: chiropractors only treat back and neck pain. Honestly, the profession wasn't started on back and neck pain. It wasn't started on car wrecks. It wasn't started on migraine headaches, or any of those sorts of things. But what we do in our office is we treat a person, not a symptom. There's a big difference. Disease care and most types of health care treat symptoms. Somebody comes in with a headache and they go, fix my headache. But the honest answer is this, is that when you look at it, we really want to treat what the cause of the headache is. So if there's something causing the headache and you can get rid of the cause, what's going to happen to the symptoms? Well, they're just going to go away all on their own. And we weren't treating the symptoms. So just to give you an idea, I guess some of the symptoms that people have come in with that they wanted help with just in the last couple of months: migraine headaches, regular headaches, arthritis, shoulder, knee, hip pain problems, tingling, numbness, neuropathy, chronic fatigue syndrome, fibromyalgia, scoliosis, stress and tension-related disorders or problems, sports injuries, TMJ and joint problems, just to name a few. But I'm not treating the symptoms. The symptoms are important, just as the patient is important. But what we want to do is get rid of the root cause of the problem. Therefore, the symptoms will go away on their own with the proper type of care. And that's really the difference. So this is Dr. Jason Jones, bringing you practical wellness tips. And as always, don't keep us a secret.